So, hi everyone. I am very, very happy to have with me a proud DAMS student, Dr. Rajesh Gowda. He has secured an amazing rank 63 in INICET May 2023. So, heartiest congratulations, Rajesh. It's an amazing rank.
Thank you so much, ma'am. Means a lot.
And how do you feel about it? Getting a rank in top 100 in a very prestigious exam. And we all know the exam was also a little atypical this time. So, how do you feel about it?
I was not expecting within 100, ma'am, because I
Yeah.
made so many silly mistakes.
Okay.
So it was like not expected at all. I was like just checking the result and I got to know that I got a two-digit rank. So
Wow.
then I was happy. I didn't,
Right.
after reading for INI was very difficult. I tried to read, but I was not able to focus.
Yeah. Okay.
So I didn't read for a month. I stopped reading for a month.
Okay. So how
Last
did you
20
make the
days
comeback?
Last 20 days, I decided at least I'll do DVT.
Hmm.
TND notes I have made, like whichever topics I felt difficult or I don't remember,
Right.
such topics I made notes of TND, ma'am.
Okay.
So I just went through them and yeah, that's it, ma'am.
So
And I
great.
have
No,
made my 20th notebook.
yes. So I think although it was difficult for you to sort of start all over again, I'm sure whatever you have done has really worked for you, and it also shows that your basics must be good. You must be good with concepts because the paper was more of ruling out by using your concepts and your basic knowledge. Am I true?
Yeah, ma'am. Yeah. Yeah, I completely did the same. Even for the simplest possible questions, I just tried to rule out every option.
Yeah,
Many questions were like multiple choice questions, like A correct, A B correct, A B C correct.
that's
Such
right.
things, all the questions I tried to rule out. Maybe that is the reason I got a two digit rank even after not reading for a month.
Yeah, that's right. That's right. And which tells us that, if you are good with your content, if you understand the concepts, you can do well in the exam. So it's not just about the last month. It's about your consistent work.
Yes, ma'am.
All right.
I
And
have been
yes, yes, please carry on. Tell me.
I have been reading since last around 8 months. So
Yes.
I think that somehow that long-term memory helped me a lot in the exam.
Agreed, agreed. And that's what I'm trying to, take out because, it's not just the last minute effort that fetches you a good rank. It is consistent efforts. And Rajesh has been an ultimate app live user. He's done a TND as well. And I'm sure he was giving all the tests as well. So can you tell us a little about your strategy, Rajesh? How did you strike a balance between notes and testing? How did you work on your weak zones?
I would suggest to those who are seeing this video to start giving GTs as early as possible,
Okay.
especially DAMS CBTs, because it gives you that real exam experience with the same pattern of questions,
Yes.
same time. Like during 9 to 12, we used to have the CBTs. So
Yes.
I tell them to give CBTs and GTs as early as possible, ma'am. And I prefer the 20th notebook should be made as early as possible, and that was my
Right.
only weapon. DVT, TND notes, and 20th notebook. Only these I read in the last 14 days. Nothing else.
Okay, so let me ask this part here. How exactly were you making your 20th notebook?
I didn't try to add everything, whatever I felt important. Only with those which I didn't difficult for me to remember, are
Okay.
only like numericals. For example, gene mutated, chromosome
Hmm.
number, such things only I added,
Hmm.
ma'am, because I didn't wanted to add all the conceptual things that will be remembered anyhow.
Yes, that's true.
And 20th notebook should always be personalized. Only they'll be knowing what are their strengths and weakness.
Yes.
So yeah, I added whatever I knew things I should remember before exam. So all such things I added, ma'am. I made around
Okay.
300 pages notebook for
Okay.
all the 19 subjects.
And this and DVT is what you said you did in the last towards the exam,
Yes, ma'am.
your 20th
Because I
notebook
don't
in
wanted
DVT?
to make mistakes in basics.
Yes,
DVT is full of basic and the things you must know for whichever exam. It might be NEET, INI.
yes,
The
that's true.
tagline is DVT for NEET, but still it is important for INI too. They're like it's not like they won't ask basics.
Yes.
So I
And this
did
time there
DVT.
were, and in fact, most of the paper was to be done with basics only because,
Yes, ma'am. Yes, ma'am.
there were weird questions and unusual things,
Yeah.
right? Okay, great. So now can you tell us something about your exam strategy? Something that, you can tell us about how you, when you were giving the exam, it must be that some questions you felt were difficult or out of the blue. How did you manage your time? How did you keep your calm? How aggressive did you go in the paper?
When I started the paper, I was like, anyhow, I'm not going to get a good rank because I didn't prepare well. This was my mindset initially.
Okay.
So, and I had
And then
got
you
a
land up getting and then you land up getting rank 63. Not fair.
and like I got a rank 81 in NEET PG, ma'am. So I was like, it's okay, even if I get or not, I'll
Yes.
give my best shot. This is the thing,
I
like
think
where
this
I'll give.
really helps. This mindset really helps that there is nothing to lose. Whatever you are
Yes,
doing
ma'am.
is going to be like an add on and a cherry on the
Yeah.
cake or a new avenue that opens up for you, right?
Yes. I was like, okay, whatever it is going to be, I'll give in the calm mindset. Whether good or bad, I'll just give.
Yeah.
So, like I tried to roll out, I started finishing 30 minutes early. So I just went
Okay.
once again went. I
Okay.
don't wanted to put many questions in the review, so I marked it in the ticket back side, whichever I
Okay.
wanted to review, because I don't wanted to put it in the review and again visit and waste the
Yeah.
time. So
Yes.
I
Yes.
just
Yes.
wrote it down in the back side of the hall ticket, and like I just whichever questions I felt difficult, I tried to roll out as much as possible.
Okay.
Every single question I ruled it out, ma'am. That's how I got a 63 rank, I
So
think.
how many questions did you attempt, Bache? All 200?
No, ma'am, I attempted 195.
Okay. And what were the five questions that you left? Were they biostats?
Completely biostats.
Yeah, I know,
Almo-
I know.
Out of five questions, four were from biostats and one some gene mutation they asked that I left.
See, I knew what you have done in the paper. Okay, that that's wonderful. So, okay, and now can you tell us something about, especially about INI set preparation? How do you think that anyone who's preparing now for November INI set, how can they focus? What are the key areas that they should look upon?
It is no secret anymore that INI usually like heavily depends on the basics like first year and basic sciences, ma'am.
Right,
First year,
right.
second year, surgery, OBG, PSM. These are the main things they focus on.
Yeah.
So I actually did these subjects like DVT completely. I tried to cover DVT, TND, and my 20th notebook. Every single word I used to like not
Okay.
miss any single word from these subjects. And after ENT, and I tried like only to cover. It's okay even if I don't get because they don't ask so much of questions.
Hanji.
So OBG and all such subjects, I tried to read everything possible, ma'am. Because the
Okay.
only limiting factor was time. I was left with only 14 days to cover as much as possible.
Yes.
So yeah, and the INICET, it is completely mainly based on first year and second year subjects.
So, how would you recommend? Because some of the first and the second year subjects are very volatile and they are pretty vast as well. So, is there any special tip that you would want to give for subjects like pharmacology or pathology, or they are fairly vast subjects?
I would recommend to read pathology, microbiology, I mean, especially pharma and micro repeatedly, ma'am, because they're
Okay.
completely volatile.
Yes.
New drugs, name of the drugs, mechanism of action.
Yes.
So there are thousands of drugs in pharma, and even
Yeah.
micro is completely like not so conceptual to remember.
Hmm.
It is more of like mug up things. So yeah, I would recommend them to go through at least weekly once, not at least a single topic.
I think that's a wise advice. You could break these subjects into smaller topics
Yeah.
and dedicate a few hours, to each of them in a week, maybe even like 1 hour and revising one topic.
Yes, ma'am.
And
Yes, ma'am.
I think his idea is right. So when the subject is volatile and vast, you just break it into smaller parts and you keep doing it rather than simply leaving it for the last time, because anyways it'll be more time consuming then.
Yeah.
Okay, great. And anything special? Although you did mention your revision program, what you did was, I know, your 20th copy and DVT. But anything else that you would want to specify for revision, especially close to the exam?
Close to the exam, same and pharma, micro, and few of the numericals of OBG,
Okay,
and even surgery, like when to do surgery, like more than 2 weeks, less than 6 weeks. All such things, it's better to be written in the 20th notebook because these are highly volatile. And when you sit in that exam, that situation,
yes,
such things will get like you. They are the things we get wrong. So it's better to have a look at them just before the exam.
great. And what branch do you want to pursue, Rajesh?
Medicine, ma'am.
Medicine, wonderful. I'm sure you're going to be a great internal medicine doctor, and you'll do exceedingly well. Okay,
Thank
can
you
you
so
tell us something non-academic about Rajesh? So, can you tell us, apart from yes, being a very good student and doing well in the exams, what else has Rajesh done to keep his mental peace and mental balance?
I used to go out with my friends. I have few PG friends, ma'am. Like I was staying at a place where I did my MBBS and internship.
Okay,
So I used to go out with few of my PGs. They are very close to me.
okay,
So whenever I feel too stressed and I like, okay, I'm not able to read anymore. So I used to go out with them.
okay.
So yeah, and they used to motivate me so many times. It's okay, just a few days away.
That's
Give it
right.
a shot and be done with it.
That's right. Somebody needs to keep pushing you, right? So I think having a good close circle of friends,
Yeah.
who cheer you up and who give you positivity, is what I think everyone needs. So okay,
Yes,
Rajesh,
ma'am.
and some advice that you would want to give to people who want to appear for November INICT.
Be strong with your basic sciences, like first year, second year subject,
Okay,
and try to be consistent. Do the PYQs, though this year the PYQs weren't much, but still PYQs are the base for any question they'll ask. I would prefer to, like, I should tell them do the PYQs properly, in depth,
Hanji.
and be updated with new drugs. Though not all, at least important ones, like new drugs should be, they should be knowing. And yeah, ma'am, like OBG, surgery, PSM, this is the things they'll always and always ask.
Yes,
Try to
great.
remain calm during exam.
Yes, very, very essential. Right. So thank you so much, Rajesh. It was a pleasure interacting with you. And the entire team of DAMS family is going to wish you a very bright future ahead. And thank you so much for making us a part of your journey.
Thank you so much, ma'am. And I must say the two words of yours during class, Bachaji and Bacha Party, were my favorite.
Ah. Okay. Sometimes, I know you all are grown ups, and you can take care of yourself. But I think somewhere deep down, we all need someone to tell us that, it's okay. You're still kids and you're growing up and everything is fine.
Yeah,
Right.
yeah.
So
During
we
that
all
whole
need,
8 hours of class, that such words were like, it used to feel nice.
yeah, I can understand. Thank you so much and wish you all the very best. Thank you once again. Take care, Vita. Bye.
Thank you so much, ma'am. Thank you.